And I'm Valerie Reeves, who will be doing the seminar today, and I'm sorry that we put healthcare reform made simple, because that was kind of a little bit of a joke, to say the least. As I've told some of you, I'm so tired of talking about this I could scream, frankly. And not a lot has changed, unfortunately. We'll dig down as deep as we can today. I'm going to try to keep it on a very basic level. There's going to be a lot of questions. I'm going to see it on your face immediately. Hopefully, a little bit later on, we're going to have time for questions, and then you can ask questions. There's a lot that we still don't know. I want to let you know that right now, as far as the exchanges go, we still don't know who's participating. We have no clue what plan designs look like, and we have no clue on pricing. I talked to one of the carriers yesterday. They have had their rates into the Department of Insurance since April and still do not have an answer. So we're just tap dancing daily, and every day the tune changes. So hopefully this is what I know today, and we will move forward from there. So go ahead, Chelsea. As we very well know, the Patient Protection and Affordable Act was passed in March 23rd, 2010. They call it PPACA. You're going to see a lot, you're going to hear a lot of terminology sometimes that confuses you, so hopefully that I can keep that a little bit straight for you. Then, of course, we're going to be living with this for 4 more years so far. How Americans will get health insurance. There's going to be 4 ways that you're going to be getting health insurance come January 1 of 2014. Half of us will continue as we are today. We'll be getting it through our employer. There will be 1/3 of us getting it from the government. That's Medicaid, Medicare. We're going to have a lot of people that are going to go out on their own at this point in time and buy it on an individual basis. And then there's going to be a lot that are not going to do anything, just as it is today. What's coming in 2014? These are the main points. Your exchanges are health insurance marketplace. They've gone from the term exchange to marketplace. Individual mandate, everyone's going to have health insurance. Guaranteed availability of coverage, there's going to be no more, no, we're not going to insure you. We're going to have essential health benefits. Now this confuses people. Basically, every policy that you currently have right now has essential benefits in it. There's not anything really new about this except for one thing. Pediatric Dental will be added to essential benefits that right now does not exist in your current policy. And I'll go over a little bit in a few minutes what Pediatric Dental means. Now, keep in mind, if you're single male 26, you have no children, you will be charged a premium for pediatric pediatric dental. Also, that young male will also be charged, in his premium will be maternity. So, that can get interesting. Preventive care will be fully covered, and what that means is not only will it be fully covered, but you will have no expense. It will all be paid at 100%. No annual limits on coverage. A lot of you, you have $5,000 a year on durable medical equipment, for instance. All those types of things will be removed, and there will now be no lifetime maximums. It's an open-ended ticket. Wellness programs will be introduced, and wellness programs will be used for people to try to reduce their premiums. Employer pay mandate, we've all heard about this, about the taxes and everything. That has been postponed to 2015. However, I will spend a few minutes on it simply because those of you that are going to be in that arena need to start tracking it now and coming up with some ability to track if you're going to be in the player pay arena. Employer and reporting of employee coverage actually goes in with the player pay. Rating restrictions, what that means right now is that we will no longer be rated according to age, sex, any type of health conditions at all. No pre-existing conditions, so as of January 1, you get a policy, you've got cancer, you've not been able to get coverage, you will have it immediately. And waiting periods cannot exceed 90 days. Now, a lot of you all have the first of the month following 90 days. At your renewal, you will have to change that it goes into existence on the 91st day or the first of the month following 60. But you will have to eliminate that first of the month following 90 days. What are the essential benefits? As you can see, 10 categories of mandated essential benefits. The defined small group, and by small group, I mean 50 and below, is considered small group. They're saying that your deductible can be no more than $2,000 on a single and $4,000 for a family. It is subject to community rating, which means basically we're going to have 8 areas in the state of Kentucky. They are actually the Medicaid regions. And so every region will have a totally different rate, but you and your neighbor next door will be paying the same rate. So Bardstown, Kentucky, for instance, will have a totally different rate than what Jefferson County will have because of the Medicaid regions right now. Essential benefit coverages, you can see, and you can go down through there. Most everybody has all this, but number 4, there's the pediatric services, including dental and vision. That is probably the only one right now that your policy does not have. That will be in existence in 2014. Your maximum out-of-pocket can be no more than $6,350 for an individual and $12,700 for a family. Now, the way we're used to the health insurance arena working is if you met your deductible and then you met your out-of-pocket, then you still had to continue to pay copays. One of the biggest changes that will happen in healthcare reform is any dollar you spend goes towards your deductible and your out-of-pocket. So if you have a $15 copay for your physician and let's say your plan has that $6,350 limit, then you have no more copays. So once you hit that, there's no more expense to you whatsoever. So every dollar you spend, whether it's on prescription copays, office visit copays, ER copays, all of that will go to your deductible. Expanded women's preventive health services. This is probably one of the biggest things in the arena that has happened and has caused some controversy along the way. But affected plans will be all non-grandfathered plans. In a minute, I'm going to explain to you what a grandfathered versus non-grandfathered plan means. Years beginning after 8/1 of 2012. Once you renewed after 8/1 of 2012, unless you were a grandfathered plan, this wellness benefit went into effect. So it automatically happened at your renewal. And those are some of the implications, the plan documents. So your plan documents and SPD will need to be amended. However, when you did your renewal, that new SPD or plan document would have that information in it. Here are some of the services that are included. Well, women's visits. You can go down through there and you can see all the different types of things that are now available to women at no cost to them. Pediatric dental benefits. This will cover dependents up to age 19. Pediatric dental is going to be required on all plans. Now, the question that I've asked the carriers is this. If we already have a dental plan in existence, which about 99% of my groups do have dental insurance, is this pediatric dental going to be an issue? No, it will not. The pediatric dental, from what I have found out from the different carriers, will be built into your deductible and your out-of-pocket. So if you take a child in for a cleaning, for instance, it's going to be subject to your deductible. So what have we really done there? So most of your dental plans pay all your preventive stuff at 100%. So we're going to find that probably most of these plans, you're still going to need your dental plan for pediatrics as well as adult. That's not really going to change. The only time you'll see this be an issue is on the individual arena where they're going to definitely add that in. But it doesn't really affect your current dental benefits if you have them. And it says here, unless the health plan gets reasonable assurance that individuals have purchased an exchange certified pediatric dental plan, which that will not be any issue with the dental plans that are currently in place. The scope is what to be covered is by each state individually. I have no clue. They've not told us that. All we've been told by the carriers is it will be subject to your deductible and the co-insurance. And orthodontics will be covered if it's medically necessary. That'll be an interesting one. Very interesting one. Yes, I can see the phone calls coming into the office right now. The doctor says it's medically necessary, but the insurance carrier or whatever says no, it's not. Medicaid expansion, Todd's going to go into that in a lot more detail. But Medicaid expansion, starting in 2014, Kentucky has voted to do their Medicaid expansion. Anybody that has 138% or below of the federal poverty level, which you can see what the poverty levels are for a single versus a family, will be able to be enrolled in Medicaid. The working poor was the main target of the Affordable Care Act. However, the Supreme Court threw out the Medicaid expansion. They were going to require every state to expand their Medicaid. So there's a big fight now. Every day I get emails from the National Association of Health Underwriters telling us this state's fighting Medicaid expansion. We're going to go broke in the state government. There's big fights all over the United States on what states are going to expand Medicaid. However, we will be expanding the Medicaid arena. Public health insurance exchanges. This is The exchanges are nothing more than a place to shop health insurance. We try to make it more complicated than it is, but it really isn't. So the state will set up an exchange. There's going to be a public exchange that's run by the state of Kentucky. We're one of the 17 states in the nation that have voted to do our own exchange. A lot of states have said the federal government, good luck, it's your baby, you figure it out, which the federal government did not figure that was going to happen. And then you've got some states that are actually half state run and half federal run. We can imagine the excitement that that's going to create. The concept is an insurance plan that allows large groups of individuals and small employers to form risk pools. So what we're talking about is spreading the risk over large numbers. That's what we've always done, but this is a new concept, evidently. A nonprofit entity will be formed to oversee it. Here's the website. This is for Kentucky that set it up. You get it? Oh. Got it? This is Connect. It's just www.kynet.com. .org? Yeah. Okay, sorry, it's not up there. My technical person here. Thank God I have her, trust me. I went on yesterday. I've been out of the country for a couple of weeks, so I thought, well, when I come back, we'll be up and running. Au contraire, not happening. You go on there, and it gives you a fact sheet of you'll be eligible to go on the exchange, and we'll let you know how you're going to shop it. That's it. There's nothing on there. No companies on there, no rates on there, no plan designs on there, no nothing. And this is supposed to go live October 1. So we do have a state exchange. Individuals and small employers will be able to go onto the exchange. Here's what the exchange plans are going to look like. We've gone mineral. Platinum is a 90% coinsurance, gold is 80%, and I would say probably 90% of my clients are in the gold arena right now with an 80% coinsurance. Silver 70%, bronze is 60%. There is going to be a catastrophic for those that are very young and can't afford any insurance at all. Not sure how that's going to work, but that's what they say. Bronze is going to be the one that everybody is going to have in place, minimum, in order to keep out of being fined in healthcare reform, particularly in large group. Most everybody that I insure has way beyond a 60% coinsurance, but that is the minimum value. So what that means is that an insurance company's got to pay 60% of whatever costs there are after the deductible. And most of all of us now are operating on an 80%. So most of us already have something that's way above the minimum value plan.
Not only will the bronze cap out at those maximum amount of hospital.
Yeah, we can't go any higher than that. Now, the talk about the deductibles, the $2,000, the $4,000 deductibles that everybody's gotten so uptight about because, most all of us have more than a $2,000 deductible right now. Well, when the insurance companies started working on their rates, they found that there was no way in the world they could get to this bronze level at a $2,000 deductible. So I think what you're going to find is when you're shopping your health insurance, you're going to find out that your deductibles are pretty much going to be what they are today, $3,000, $4,000, $5,000. I talked to one of the carriers the other day. To get to their bronze, they've got to have a $5,000 deductible in order to meet that. So this fear that we're going to have to really change our plan designs and really going to have to go to low deductibles and drive the cost up, we're not seeing that part of it. So, but your plans are going to have to look like this. It's supposed to be fully operational and available October 1 of 2013. I talked to a carrier yesterday to see where we are about the insurance rates for healthcare reform. They've been in the Department of Insurance since April of this year, and they still do not have approval. So, not real sure what's going to be happening here when they flip the switch. Another problem we're going to have with the exchanges, and this is a big issue that's just coming to the forefront, is the security of these exchanges. Because here's part of the problem. Let's say I'm an individual. I want to shop health insurance. I don't have an agent. I'm a tech person. I can go online and shop my own health insurance. So they go on, they look online, they call a navigator, a call center. These people that answer the phone are navigators. First of all, you're going to have to give them your date of birth, your social security number, all kinds of things. And they have not been, have a background check. Yes. That's really scary. The systems, they say right now, do not have the amount of security that they need for all this information that's going to flow through healthcare reform. So I don't know what's going to happen when the flip is switched. but we've got to be very careful about who we deal with when we're giving this personal information to get health insurance, because I have to have E&O coverage, I have to be fingerprinted, I have to do all kinds of stuff, and these people are going to be telling people, getting information, and they have not been vetted at all. So I see that as a real issue. The public exchanges, the two ways that you're going to use the public exchange is in the individual market and what they call the small business shop. This is for employers under 50. That's the public exchange. My understanding right now in the small business shop, the only carriers right now that are going to be in the shop on the public exchange is Bluegrass, Anthem, and there's a new company coming in called Kentucky Health Co-op. A lot of your carriers are not going to participate in the shop for small employers. They're going to set up their own private exchanges, and we'll talk about those in just a minute. But the individual market, you will have to go through the exchange, and all the carriers are going to participate in the individual arena. Notice of options for coverage. Now, this is something that's very, very important that you've got to have in your hands to the employees by October 1. What this does is tell the employees that they are eligible to go out into the exchange. I don't care what size group you are, everybody has to give this to their employees in their hands by October 1. Department of Labor, you can go on the DOL and you can go on and you can look at what they've got a model notification out there. It's really not that difficult at all. There's just a few things that you have to fill in. If any of you need that actual model notice, I can email it to you and you can take a look at it, but you're going to have to give it to your employees if you offer health insurance, and you're going to have to give it to your employees if you do not offer health insurance. And that is a regulation that the Department of Labor has put on everybody. So nobody's exempt from this one. Minimum value. I talked about minimum value, which means the plan has to pay at least 60%, or the bronze plans that we've talked about. It applies to plans with a new or renewing effect January 1 of 2014. Now, there's been some discussion about, well, you know, is it affordable? The way that we're going to consider something being affordable to the employee is if the employee does not have to pay more than 9.5% of their W-2 earnings for their premium on a single plan. We're not taking in dependent coverage. We're not taking in any of that. It's simply the employee premium. Now, you can offer dependent coverage. That's fine. You can pass that cost on to the employee, but the main thing you have to be focused on is that 9.5% cost for employees. Now, here's an interesting thing with healthcare reform. Dependents, according to healthcare reform, does not include a spouse. I think some people take issue with that, but that is the government's definition. So some employers can offer an employee and an employee child rate and do not have to include a full family or employee spouse if they don't want to. But the dependent definition is children only under healthcare reform. Now, an employee purchases a qualified health plan through the exchange, and they can. If you offer the health insurance to them, they don't like it, or they're not happy that day, or they don't care if they don't like that plan, and they want to go shop it themselves, they can do it. Groups under 50, there is no penalty if they do that. Groups over 50, starting in 2015, there will be a penalty if they do that. So if they through the exchange, the employee may lose the employer coverage, and here's the big thing about the subsidies and the tax credits that you hear everybody's going to get if they can't afford their health insurance, and Todd's going to go into more detail about that. They will not get a subsidy. Here's the other interesting thing. Let's say you've got an employee, his spouse can go, and you're offering health insurance to the employee and dependents, but the dependent can go outside and go to the exchange and get coverage for less money. That spouse, even though they fall within the parameters of being able to get a tax credit or a subsidy, they won't get it at all. And I think that's a shame, because that's part of why we put these subsidies and tax credits in there. So if an employee can get health insurance through their employer, the dependents or even he decide to go out onto the exchange and they're within that level of getting a subsidy, they still won't get it because the employer offered the health insurance. Not considered a dependent, but still, they won't get a subsidy. Just, it's one of those, these are some of these things that are coming out now that people didn't realize. These are quirks that when the legislation put this stuff together, they really didn't know what they were dealing with. They really did not know. You know, when they go online and the federal government offers them health insurance and they sign up and it's paid for, there's no reason to be involved in this and understand what exactly is going to affect the people out in the real world. Of course, the big fight now, too, is Congress. Some of the Republicans are trying to pass legislation that's making the federal government, interestingly enough, participate in health care reform. And they don't want to. Really? Yeah. Yeah. Yes.
Valerie, so you said if an employee pulls out, the employer gets penalized? Is that who gets penalized?
50 and above.
Right. So the employer gets penalized.
The employer gets penalized, but also, too, the employee does not get a subsidy.
I guess the rationale is if we didn't do enough job to keep them in the plan.
You know, I can't tell you what their thinking is.
You're not providing minimum coverage. This is to cover everyone.
Yeah, and we'll go into what triggers the taxes and the penalties here in a few minutes. And again, that's for only people 50 and above, and we don't have to deal with it to 2015, so at least this will give time for these larger employers to be able to start tracking this a little bit. All right? Now, private exchanges, what they may look like. From the conversations that I've had with the carriers, what is going to happen is it will change how the employer lets their employees shop for health insurance. So let's say you decided to, when I come in with the rates and we spreadsheet them and everything like that, and this private exchange probably looks better than anything else. Because keep in mind, you can go to the public exchange, you can go to the private exchange, and you can keep on doing what you're doing. So the way that you now deliver your health insurance, as far as the standard, I come in and here's Anthem, Humana, $3,000 deductible, $25, that's not going away. It's simply the pricing and the plan design. So you've got three options and three ways to shop. Is the public exchange, the private exchange, and then just regular insurance. Now, we may not like the price of the regular insurance because now supposedly we have more competition, but that doesn't mean you have to give up the way that you're doing your insurance right now. You just may not like the cost. So we're looking at three different ways and product design to decide which way is best for you and your employees. But a private exchange, what they're going to look like is the private exchanges are, you're going to give your employees, say, $3 a month. It's called a defined contribution. The way health insurance is structured today is called defined benefit, which you go in, you shop it, I'm going to pay 80% of the premium, you're going to pay 20% of the premium, and it's the way we do it today. That's called a defined benefit because you are paying part of the premium, you're deciding the plan designs, all of that kind of thing. Under the private exchange, it'll be called what's defined contribution, which has been around for a long time, but it's now taking a lot more notice. Every employee, I figured out I've been spending about $300 a month on health insurance per employee. So now instead of me applying that to the premium, I'm going to give the employee $300. Now you go shop. You're going to have health insurance on there, you're going to have dental, you're going to have vision, you're going to have some of your voluntary products like cancer, all those types of things. So the employee has a $300 bucket of money, and he goes down and he clicks on this, he clicks on this, and he clicks on this. You spent your $300, and oh, by the way, here's a payroll sheet because now you're going to pay $25. By the time we applied your $300 credit, this is what you're left with to pay for. So what that does, that takes the employer out of the loop of making decisions for the employees. They get to make their own decisions. You have a fixed cost to you, and the employee gets to pick and choose what they want to do. Now, one of the things you're going to find in the private exchanges and the public exchanges is HMOs are going to come back big time. And if you choose a plan on these exchanges, it may say you can only go to Norton Hospital and Norton Doctors. Or you can only go to Baptist East Hospital and Baptist East Doctors. So these networks, in order to control cost and compete with each other, they're going to get very narrow. So our sense of freedom of being able to go wherever we want to go is going to narrow down big time. So we're going to see a change in how the health care is delivered and where we can go and what we can do. Yes?
You mentioned public exchange and private. I'm assuming the KY-NEC, that's the public exchange?
That is the public exchange.
Is there a website for the private, or what?
No, it will be per carrier. Every carrier will have their own private exchange. So let's say, for instance, we look at the public exchange, and we're going to be looking at Anthem on the public exchange, and we look at the pricing there and the plan designs there. Then we go over here and we look at Humana, who's got a private exchange, and we're going to look at the product designs, we're going to look at the pricing, and then we're going to decide which one's best for us. Do we want to continue to help the employees make a decision, or are we going to give them X number of dollars and you go shopping?
Well, how's that different than just shopping? I thought our public exchange, private exchange, or just shopping. The way you just described private exchange, that sounds like.
It's just a different way that the employer uses money. You know, right now I come in and you say, okay, Valerie, I want health insurance, I want dental insurance, I want vision insurance. So I quote it as a group, all right? And we have to have a certain participation level in order for that coverage to go into effect. Under the private exchange, your employee may have 3 plans to choose from. So he's going to pick which plan he wants. He doesn't want vision, but he does want dental. So now the participation levels and everything have gone out the window. It's like buying individual insurance through a group product. That's all it is. Does that make sense? Again, yeah, confusing, I know. And unfortunately, we talk about all this stuff, but as an employer and as a business person and a person that deals with the benefits, until you have real numbers in your hands and you have real plan designs, this doesn't make any sense. It doesn't make any sense because you don't have anything to look at. You don't have any pricing to look at. There's nothing to get your hands on. So all we're talking about now is concepts and how they're going to look. But until you actually sit down at renewal and start looking at these different options, is it going to make sense?
Are the private exchanges going to be on a state-by-state basis like the public exchange?
Yes.
I'll assume that the $300 that you just mentioned as a contribution is not taxable, the FICA and all that stuff?
It will not be taxable to you as long as you have a cafeteria plan in place, and you have to amend your cafeteria plan to say that we're going to give them spendable dollars. Right now, most people that have a cafeteria plan, it's a flexible spending account for unreimbursed medical independent daycare, or it's a premium only because whatever portion the employee does comes out on a pre-tax basis. Everybody with me on that? Okay. Under the exchange, you have to have a different section of the cafeteria plan in place that states that you're going to allow payroll deduction and spendable credits. So as I work with my groups, we're going to be talking about, is this the way you want to handle it? And if you do, then we've got to amend your cafeteria plan.
Valerie, is it all or none? So all your employees have to go to exchange, or can we have a blend of both?
No, it has to be one. It has to be one or the other. Unless you just say, I'm not going to offer any health insurance at all, and then they can go do what they want to do.
Then what's the purpose of the notice officer first so they can go to the exchange?
Just letting them know.
But even though they can't?
Well, they can. They can leave you, and they can go do what they want to do. They lose your contribution.
Then the other question I have is, okay, you say the defined contribution is $300. Can you give them the option of taking that as cash, or do you have the company has to say, no, you can only use it for cafeteria?
3 things you can do with that money. You can say, no, it's only eligible for benefits. Or what you don't spend, we'll put in a flexible spending account for you. Or you can take the rest of it in cash. I see very few people giving it as cash because it's tax deductible to you, it's taxable to you, and it's taxable to them.
Yeah, plus it's more than the fine that they would get if they didn't buy it.
Right. Also, too, unbeknownst to a lot of people, that $2,500 limit that the IRS has put under cafeteria plans, that does not include employer contribution. That is only the employee's contribution. The employer can put in whatever they want to. So if you've got an employee that's putting in the full $2,500, we've given them $500 a month to spend, they only spend $300 of it, that $200 is considered employer money, so they can put that in their flexible spending account. And it's still non-taxable to anybody. Everybody with me on that? Okay. Well,
I may be getting ahead of your presentation, you may be mentioning this, but what about HSAs, health savings accounts?
Health savings accounts still have their same limits that they've always had with the IRS. That doesn't change. There's an annual limit between employer and employee contributions. That doesn't change. Really, you're not going to see HSAs be affected much by health care reform. I think a lot of people were scared they were going away or they're going to have such low deductibles or something like that. From what we've seen, they're going to stay pretty much standard. But that's controlled by the IRS in that situation. Cafeteria plan, okay? Right now, cafeteria plan says as part of health care reform was an employee can't put in more than $2,500 a year in their flexible spending account, okay? It doesn't address employer contribution because you can, as an employer, put money into the flexible spending account. So under health care reform, if you do a defined contribution, I give my employees all $500, a single, if they buy everything, they're only going to spend $400 a month of that. I got $100 left over. I can specify in my cafeteria documents that that additional 100 will go into their flexible spending account. Therefore, they've not lost the money, but it's non-taxable still at this stage of the game. Does that make sense now? Okay? So the private exchange, again, will go more toward the defined contribution because the website will be loaded up with all different kinds of benefits, and you just pick and choose what benefits you want. And the exchange sponsor will handle more of the ACA, keep the regulations and stuff like that. It's just a way for you now to get out of the employee benefit arena of picking a health insurance plan and the employee says, I want a lower deductible, or I don't like that out of pocket, or the copays are too high, or whatever. Kind of takes you out and say, okay, big boy, here's your money, go shop. And it does take it off of you. You've got a controlled cost to you as a corporation on the bottom line, and it gives the employees the freedom to do what they want to do with their money. New rating rules. Now this gets very confused. Non-grandfathered plans now, the only things they wait for, tobacco use, family size, and geography. Remember when I talked about there's going to be 8 regions in the state of Kentucky? Your price will be controlled by whatever region that you're living in at that point in time. Now, tobacco use, Kentucky has decided that if you are a tobacco user, that we will be able to rate up 40%. Here's the interesting thing about this, is number one, you're on the honor system, so I'm going to take a 40% hike in a premium. There is no repercussions if they lie on an application. We can't rescind it. We can't do anything with it. It's basically an honor system. We trust you, pat you on the back, and so a lot of carriers are saying they're not even going to put in tobacco rates because there's no sense in it. This will be the most tobacco-free state you have ever seen in your life. Come January 1, we're going up to #1 healthiest when it comes to tobacco. So most of your carriers are just going to eliminate that. It's not even worth the paper that's written on for that one because there's no way to monitor it. As a small employer, there's nothing you'll need to do. We just walk in as of January 1 and say, okay, when your renewal comes January or the year 2014, here's all your options. And you'll have 3 ways again to shop: public, private, and then the regular way that we're doing business right now. And of course, premium variations. I will tell you this. The carriers are pretty much giving us an idea of what you're going to look like in 2014. I probably maybe have 4 groups that are going to come out ahead in healthcare reform. The rest of the groups are going to take a tremendous hit. Some of my groups, they're older, they've got health issues. Every year they get that rate up and everything like that. They're going to see their premiums go down. And the people that have been healthy, you're going to see your premiums go up. Grandfathering. Now this is what you talked about, and I'll go over this one briefly. All health plans that were in place March 23rd of 2010 were grandfathered from that point on unless you made a change. You changed your contributions, you changed your deductible, you changed your copays. If you made any plan changes at all, you moved to a new carrier and kept the same plan. That was still considered taking you out of grandfathered status. So, a grandfathered plan had to be continually, and nothing changed since March 23rd of 2010. How many of you have not made a plan change since 2010? I got a couple. So you're grandfathered. So that gives you special privileges, I think. All right, next one. Here is the ways that you're going to lose grandfathered status. So once you renew, you're going into healthcare reform if you're non-grandfathered. If you're grandfathered, at your renewal in 2014, you'll be able to keep your same plan. Or you can keep it. You may not like the price, but you will be able to keep that plan as long as you make no changes at all. So those are the clients that I have that are grandfathered will be coming in with your rates with your grandfathered plan. Will be coming in with your rates with the private exchange, the public exchange, and then just changing deductibles and losing grandfather status. So all we're going to do is change the way we shop. That's all it is. Those that keep it can continue to do what they want to do. Again, you'll just may not like the renewal we bring in. Next. Actuarial value. I hate this term. It's so confusing. The government's decided that every plan has to have an actuarial value. What an actuarial value means is this. You must at least cover 60% of coverage. That's all that means. That is the baseline. So when I come in, you're not going to see anything below 60%. It'll have to be 60% and above. Actuarial plan, again, 60%. That is defined by the healthcare reform, and you also have to have all the essential benefits, unless you're grandfathered. All right. Out-of-pocket maximums, we talked about that, $6,350, $12,700 for a family. That does include your deductibles, your co-pays, and everything. Now, there's been talk that, oh, by the way, guess what? Stranger danger. If you have pharmacy, then you have to meet an additional out-of-pocket. That is only for plans that are self-insured. When you're self-insured, you have a medical provider, and then you have a pharmacy provider. So if your medical and your pharmacy are totally separate, then your pharmacy will be subject to a different out-of-pocket. So just want to let you all know, you're going to be hearing a lot of this, and you're going to go, oh no, I've got to pay for pharmacy, so guess what? I'm going to have another out-of-pocket for pharmacy. On fully insured plans that you've got now, this doesn't affect you.
Out-of-pocket, 9.5%. Yeah, I mean, it probably doesn't apply to us, but I can see it applying to other employers. If you have, like, restaurants where they're lower paid,
Mm-hmm.
and say you have a cat, or not a cat, so what was the silver plan, I don't remember all exact names, at 60%,
Mm-hmm.
and it meets 9.5% threshold, okay, but you also have a gold or platinum for the executives or the management team, that if one of the store workers purchased the gold, it was now more than 9.5% of their out-of-pocket.
As long as you have a 60% plan, you can have what other plan designs you want to, and they can pick and choose what they want to do, but you've based that contribution, that's going to be considered on the 60% actuarial value. So you can have other richer plans, and you're not going to get penalized for the 9.5. You work off that 60% premium level, and then above that you can do whatever you want to. All right. Summary of benefits. This is something that all of you are now getting, and you're probably not paying any attention to it whatsoever. When we renew, if you'll notice, one of the first things they do is they send you this very different looking format. All that is part of the Healthcare Reform Act that said we have to make everything uniform. We have to use the same language for everything. So when a carrier sends you, whether it's Anthem, Humana, United Healthcare, when they say this is what a deductible is, the language has to say the exact same thing. And by the way, you're supposed to give these to your employees as well. All right. This is kind of what it looks like. And it will be given to you, will be sent to you through the carrier. Keep in mind, nothing hardly's mailed anymore, in case y'all haven't noticed. Everything comes email. So you can scan that in, send it to all your employees, you can mail it, you can do whatever you want to, but it needs to be in their hands every time there's any kind of plan change. Okay. Here's how the premiums are going to be effective. Guarantee issue on the individual market, you're going to see an increase and broader benefits. The broader benefits drive the higher cost. Small groups and large groups aren't affected by that situation. On individual, small group, and large groups, change in rating. As you can see, under the individual market, for healthy people, the rates are going to go up. I can't see that one. Young men and older women are going to go up. And young individuals, period, are going to go up. The ones that are going to go down is the less healthy, young women and older men, and older individuals, the rates are going to go down. What has happened when we've set these new rates up, we used to have a 10-to-1 spread we could have between the healthiest and the sickest. It has now been reduced to a 3-to-1. So something's got to give somewhere. And some are going to win and some are going to lose. Mm-hmm.
I requested a new renewal date of January 1, because I know our rates are going to drop.
Uh-huh.
But have you seen anything with that? Do they ever deny that request?
I'm going to go through the renewal process. So move on. So you can see that a lot of this stuff is going to be driving cost up. New taxes, subsidies for some people will go down. New taxes and fees. Part of your premium increase is going to be about 3.5 to 3.6 increase is going to be nothing but taxes. And then again, reinsurance programs, and Todd's going to go through a lot of the taxes for us. Small business, large business. 50 or more full-time or full-time equivalent employees. This is going to be put off until 2015. I just wanted you to be aware that this is going to affect you, but not until 2015. So if you're 50 plus, you need to be sure that you've got a game plan in place for 2015. All right. How do we do full-time employees? 30 hours. You take it and divide how many hours a month that part-time employee works, divide it by 120, and that will tell you if, for instance, that employee is 2/3 of a full-time employee. Now, seasonal employees, if they work less than 120 days a year, you do not include them in the calculation. There's been a big question about what do we consider seasonal employees, and that is if they don't work 120 days a year. All right? Pay or play, you've got to have minimum essential coverage, which means that's got all those benefits in it, including pediatric dental. Unaffordable means that they're paying more than 9.5% of the W-2 income, and there's your fines for months for that. If you don't offer minimum essential coverage, which I can't imagine anybody not doing, but if you don't, then it's going to be $2,000, or you'll get fined if you don't offer any health insurance at all. Small businesses, very quickly, 5.6 businesses are going to be the ones that are going to be impacted by health care reform. Community rating, we've talked about that. Family size, where you live, tobacco age. Here's another thing. If you're going to have a child, right now, if they're age 26 or younger, they can stay on the plan. Under health care reform, if your child is 21 years of age, then they're going to be considered an individual coverage. So it may not be advantageous anymore to keep your children on beyond age 21 because they're going to get the same rate as an individual. So they may be better off going on their own individual plan at that point. And here again, we talked about defined benefits, which is what you're doing right now. Defined contribution, the employer selects a defined contribution, employee selects plans, and the benefits can vary between what they pick. And then you got the shop, and then you've also got self-funded. If you're 35 employees and above, you may want to consider self-funding. That's just an option that you can look at, and we can talk about that, but that gets into a lot more complications.
So if you have employees who work in or live in Indiana, who work here, or you have employees in other states, and they're not in your defined area of community evaluation, how are they considered? How are they evaluated?
Well, because of your size group, because you're 50 and above, that all goes out the window for you. You basically, they're always going to base it on where the business is, unless they go into the individual market, and then the region could change. But it's always going to be based on where the employer's location is, what his address is with the state of Kentucky.
So if I move my offices to Indiana, I could get an Indiana rate?
But it's not. You can take that one off your list, Charlie. Okay. Again, if you don't offer health insurance or you decide you're not going to offer health insurance, any business under 50, there's no penalty to you whatsoever. You just have to decide how you're going to insure your employees. No coverage. These are basically some examples of this guy's a small business with 35 employees. He's decided not to offer coverage. All they do is the employees go out on the individual exchange. Early renewal options. This is something very important that I want everybody to think about. Right now, Humana, and I'm going to tell you how the different carriers are operating. Humana right now is allowing employers that have already renewed for this year to early renew, to keep you out of health care reform. That's for a 12/1 effective date. You have nothing to lose by doing an early renewal, because as long as we look at it and we decide we don't like it, by November 1, we don't have to take that early renewal and we can go into 2014. Almost all my employers are going to come out ahead by early renewing. That puts you out of the loop for a year. My average employer is looking at between a 6 and 11% rate increase if they early renew. If they go into health care reform at the same renewal date they've got right now, we're looking at an average of 35 to 65% rate increase. So you have nothing to lose, because by October 1, hopefully, we will know what the exchange pricing looks like. We know what all that's going to look like, so we'll be able to shop all this, and if the exchange looks better to you, we'll just keep your current renewal date and move you into health care reform. But please pay attention. If you're being contacted to do an early renewal, you need to seriously consider that. Also, I recommend a lot of you, if you've already renewed, that you may want to shop your insurance again, because some of these carriers have really backed off the underwriting. I just did a group day before yesterday. Saved them $1,600 a month by moving. So the carriers are getting pretty loose on the underwriting. So it's pretty favorable for those of you all, even some of you that got health conditions right now. We have found that the rating is unbelievable right now. I think they take them out at lunch and give them a bunch of martinis. I'm not sure. But I've seen rates come back that I never thought I would see, ever. So I strongly recommend that you look at doing early renewals. All right, and this is the way Humana is going to do theirs. Anthem is going to do the very same thing. And some of you that renew in October, you still can do a 12-1 renewal again. I know that's a pain, and we've already been through this. We've tap danced again this year, but we may have to tap dance again. But now that's only under groups under 50. United Healthcare, we're not sure what they're doing. They're playing, but we don't know what the rules are right now on that one. Early renewals, you can lock in a 12-month rate, happy with current coverage, not sure how reform is going to affect you, and you can roll up your coverage into one easy renewal date. And how it works is we just do off cycle, and we just do it like we normally do our renewals. Large businesses, we'll go through that. That has pretty much been postponed to 2015, so we'll deal with that later. We've got enough on our plate today. And there's the benefits and the large employer stuff. And large businesses will be doing defined benefits. They can do a defined contribution, and they can also look at being self-funded as well. That's right. If you're self-funded, you're out of that loop, period. That's why a lot of employers 35 and above are looking at going self-funded. The self-funded market for small employers has gotten much better in the last few years. You've got a lot of carriers now that are willing to look at smaller groups. Department of Labor audit. I'm going to touch on this for a minute. I've put booklets up from our own agency. The Department of Labor, let's face it, we need money for health care reform. One of the ways that we're doing this is the Department of Labor and the IRS has hired about another 5,000 to 6,000 agents in the state of Kentucky to walk into your business and say, I want to see all your records. I want to see your SPDs. I want to see your cafeteria plans. I want to see everything. Your new summary plan, coverage description, all of this stuff. There was a business in Western Kentucky, had 7 employees. They got a 7-page letter from the Department of Labor, single-spaced, of all the documentation that they wanted to see. This is extremely crucial that you address this issue, and you will have to address it with your agent, and they'll have to step you through the process. We can't do a lot for you, but we can step you through the process. We did ours. It took Chelsea almost nonstop for 2 weeks to get everything together. And I have a group of 5. So, you've got to pay attention to this. You cannot ignore this. The fines. Flip over there to the fines. Keep going. And it doesn't matter if you're grandfathered, non-grandfathered. Don't care. Here are the penalties. Go back to what they're looking for. Just to give you an idea. That's what some of the documents that they're looking for. Oh, go back again, Chelsea. I think they're wanting to take notes here just a minute. The one about the different lists that they're looking for. Now, some of this stuff applies to 401ks, but however, you've got to understand, 401ks, some of the regs that they've been passing on 401ks, they're going to pass on under health care reform as well. You're going to see a lot of the documentation now that's needed.
I've been seeing check fidelity bonds a lot more than what they ever have, so make sure you have fidelity bonds for part of it.
Yes. Yes. Yes, I'm going to say that at the end. If you'll just drop your business card, we've got out on front, there's a glass jar there. If you'll drop your business card, I'll forward all this PowerPoints. Mine and Todd's as well, so you'll have it for reference. All right? Keep going. Here's the failure. $2,000 per employee per year minus the first 30 employees. Okay. So an employee with 50 employees. An employee that offers coverage, you can see it's a penalty of $1,000 per day regardless of what size you are. And the Department of Labor gave this company 4 days to get all this together. They're not mine. All right. Here in a nutshell is what the ACA looks like right now. And I know there's still a lot of questions, and I don't know how much I've really answered for you today because unfortunately we still don't know so much of it. We do know we're going to be shopping differently than we did before. But I strongly recommend that one of the ways to put this off for a year is to look to see if early renewal is your best option for groups under 50. This will give the time for the dust to settle and a lot of the things to be worked out so you're not part of that problem. You can hopefully, it'll get worked out. Hopefully.
What if you're just over 50?
If you're just over 50, you just go through your regular renewal. And keep in mind, the insurance companies are looking at your payroll, not who's eligible. Okay? So you may have 60, 30 of those are part-time, so you're saying, well, I'm under the 50 arena. No, 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 no. They're going off payroll records. Aware of that. All right. I'm going to put Todd on now, and then we'll take more questions afterwards.